An organization that fosters diversity encourages respect and understanding of human characteristics and acceptance of the similarities and differences that make us human. We're going to continue with part 3 and complete the lesson of cultural sensitivity or cultural competence. As nurses, we must remember that in addition to our culture of origin, we are members of a professional subculture. This culture is based on the U.S. Western biomedical model of healthcare. It has its own unique vocabulary and possesses a specific perspective on health and illness with an emphasis on patient autonomy. It is a mistake to believe the U.S. model of healthcare is common to all cultures. In addition, the majority of nurses are women, as men only make up about 5.8% of the total nursing population. So when we approach a patient situation, we're bringing with us gender issues, our culture of origin, and our professional culture. Let's talk about cultural knowledge. This is the process of seeking and obtaining a sound educational base about culturally diverse groups. There are 3 areas to focus on: health-related beliefs, practices, and cultural values, disease incidence and prevalence, and treatment efficacy. You need to consider the patient's worldview, as this is the foundation for all actions and interpretations. So now I have a question for you. Do groups have different worldviews, even in the U.S.? So let's look at some examples of differences in worldviews. We have explanation according to nature, emotional relationships value, present time focus, time is always with us, a scientific explanation for everything, concern mostly with facts, future time focus, clock watching, cooperation, group needs more important than individual, privacy, non-interference, participation after observation only when certain of ability, competition, personal goals considered primary, need to control and affect others, and then we have trial and error learning, new skills practice until mastered. When looking at health disparities, the Institute of Medicine report from the Center for Minority Health documented that minorities are less likely to be given appropriate cardiac meds or bypass surgery, less likely to receive kidney dialysis or transplants, less likely to receive appropriate cancer diagnostic tests and treatments, and more likely to receive less desirable procedures such as lower limb amputations. In regards to treatments, factors that can interfere or change the response to treatment are use of herbs and alternative treatments, healthcare bias and prejudice that can lead to misdiagnosis or over-medicating, such as African American adolescents receiving higher doses for identical symptoms, or genetics can play a part in drug responses, such lithium therapeutic levels can differ in Asian patients versus Anglo patients. Cultural skill is the ability to collect relevant cultural data regarding the patient's presenting problem, as well as perform a culturally based physical assessment. Cultural assessment tools include the Campina-Bocconi, Andrews and Boyle, the Spector, the Purnell and Palanca, or Geiger and David Heiser. So what does this mean? This means we begin with ourselves. We explore our own ideas about race, ethnicity, health disparities, socioeconomic class, and differences in people. There is only one corner of the universe you can be certain of improving, and that's your own self, and that's by Aldous Huxley. I want to provide an example for discussion. A 54-year-old male who is Native American from the Ogasawara Nation is admitted for placement of a port. He is scheduled to begin chemotherapy for pancreatic cancer as soon as the port is placed. The nurse goes in to get the surgical consent signed, and the patient refuses to sign the consent. Think about why. Considering culture from a healthcare staff person and the nursing workforce perspective is a daunting task, one that can lead to a more solidly aligned service community relationship. Understanding and valuing cultural differences benefits both patients and colleagues. This concludes the lessons on cultural sensitivity or cultural competence. If you have any questions related to course content, contact the instructor.